my channel. In this video I will discuss clindamycin. So clindamycin is a bacteriostatic antibiotic. That is, it does not kill bacteria but inhibits their proliferation, and in this way it is used as an antibiotic. It belongs to a class of Lincosamide antibiotics and it is derived from Lincomycin, but these things are not very much important. It can be given orally, it can be given intravenously, it can be given topically, and vaginal creams are also available. It binds to 50S ribosomal subunit, and when it binds to 50S ribosomal subunit, it inhibits protein synthesis. When protein synthesis is inhibited, then bacterial proliferation is stopped and it leads to so it is a bacteriostatic antibiotic. So it inhibits proliferation of the bacteria. So bacterial growth is inhibited. It has same mechanism of action as macrolides like azithromycin. Therefore, it has a similar site of action as macrolides. Therefore, it has cross resistance possible. So the organisms which are resistant against macrolides, maybe they are resistant against this clindamycin. It has a very narrow spectrum of activity and it acts against certain gram-positive organisms like staphylococci, including resistant staphylococcus aureus, that is methicillin resistant staphylococcus aureus, and also some resistant streptococci are also susceptible to this clindamycin. Anaerobic bacteria like Bacteroides fragilis, Clostridium perfringens, and bacteria that are present in the mouth, which are also anaerobic bacteria, are also susceptible to these antibiotic, that is clindamycin, but it does not have any activity for gram-negative aerobes. Gram-negative aerobes cannot be killed by using this clindamycin. For example, UTI cannot be treated by using clindamycin. Clinical uses. It is used in the skin and soft tissue infections caused by methicillin-resistant Staphylococcus aureus like cellulitis. As I have told you, it is active against these gram-positive cocci. For anaerobic infections like oral cavity infections, because oral cavity contains anaerobic bacteria. Also intra-abdominal infections, for example infections caused by Bacteroides fragilis, and for anaerobic pelvic infections. It can also be used for dental infections, because I have told you this, that dental infections can be caused by anaerobic bacteria, and aspiration pneumonia, because aspiration is containing the secretions from mouth and it contains anaerobic bacteria. Therefore, these anaerobic bacteria can be treated by, that is aspiration pneumonia can be treated by using clindamycin. The thing that is important, it can be used for acne vulgaris. So it is used for acne vulgaris, and it can be used for gynecologic issues like bacterial vaginosis. The most important drug that is used for bacterial vaginosis is metronidazole. Instead of metronidazole, you can use this clindamycin, because both can kill these bacterial vaginosis parasite. Diarrhea is the most common side effect and it is mostly seen with many antibiotics. But the important one is it has a side effect called pseudomembranous colitis, because it helps the Clostridium difficile to proliferate in the intestine by killing other bacteria in the intestine, and therefore pseudomembranous colitis is a classic side effect of this clindamycin. Other side effects are rash and it is also hepatotoxic, but these side effects are very rare. Pseudomembranous colitis is a very important side effect of this clindamycin. Metallic test can be seen with clindamycin. Contraindications and cautions. The history of antibiotic associated colitis, for example pseudomembranous colitis, is already seen with certain other antibiotics, then you should not use this clindamycin, because clindamycin has pseudomembranous colitis as its major side effect. Therefore, you should not use in those patients who have history of antibiotic associated colitis. and also used cautiously in liver dysfunction because liver dysfunction is a rare side effect of this antibiotic clindamycin. It has excellent tissue penetration including bone, so it has used in a wide variety of infections. So it has good penetration in the tissues, and it is mainly metabolized in the liver and excreted in the bile and urine. So it can be used in chronic kidney disease. Half life of this drug is 2 to 3 hours. So this is all about clindamycin.